Take a seat, and then we can jump up when you're finished. Good morning. Thanks very much for joining us today. I'm joined by Health Minister Meredith Hammond, who's here to answer any questions, and also Health Infrastructure Minister John Kerry will take to the microphone after I've made some comments. And as I've said to you on many occasions, almost on repeat, my government's priorities since the election are highly focused on making sure that we deliver on health, jobs and housing, to ensure that we maintain our position as the strongest economy in the nation, and that every Western Australian has a home, and that every Western Australian can access top quality health care they need when they need it. We have the best doctors, nurses and health professionals working in our system, and many of the metrics that I'm about to mention point to their great work. And WA has the fastest ambulance response times in the nation. No other state sees a higher proportion of people through their emergency departments in under 4 hours than in Western Australia. Our record amounts of elective surgery are being performed right across the state. But that doesn't mean that there's not more work to do. Our ambulance ramping numbers are higher than we'd like, and we have some ageing infrastructure that needs careful management. That's why we have increased maintenance funding for our metropolitan hospitals by 40% since we were elected in 2017, and why we have made a record investment in new hospitals and expanded emergency departments. This investment includes rolling out a $3.2 billion health infrastructure program across Western Australia, a $50 million expansion of Sir Charles Gairdner Hospital's emergency department is underway, and a new $25 million intensive care unit is in the works. We have also committed, we have also committed more than $100 million to the development of the redevelopment of the Royal Perth Hospital Emergency Department, as well as $5 million in the 25-26 budget for planning works at RPH. But as I said, there's always an opportunity to do more. Maintaining ageing assets while we deliver on this plan is absolutely critical. And we have listened to the concerns of workers and the community at our heritage hospitals when it comes to maintenance. Today, I'm announcing that my government will establish a $50 million health infrastructure maintenance fund, and this fund will focus on projects at Sir Charles Gairdner Hospital, Royal Perth Hospital and Armidale Health Service, and will roll out across 2025, 26 and 26-27. In addition to the Health Asset Maintenance Fund, my government will be undertaking an audited review of how hospital infrastructure is currently maintained. And the review will be led by former Under-Treasurer Michael Barnes and former Department of Health Director General Dr Neil Fong. The review has been undertaken to facilitate improved procurement and contract management practices and bolster hospital maintenance into the future, and whether there are opportunities for improvements to procurement and management practices to ensure value of money for WA taxpayers. My government is working hard every day to ensure that Western Australians have access to the services and health infrastructure that they need, and nowhere is it more important than in our hospitals. I now hand over to Minister Kerry to talk through the details.
Thank you, Premier. As we know, our state government does have a big, bold and ambitious infrastructure program of $3.2 billion to upgrade, to do major redevelopments and to build new hospitals. But I've been on the record previously that we also recognise that we have ageing infrastructure, and that's why today we're announcing an additional $50 million. That money will be allocated to Charlie's, Royal Perth Hospital and Armidale Health Service. These three are our older hospitals. Of course, that funding is in addition to the existing money that we're already spending on hospital maintenance, which is budgeted for this year at $271 million. It's a two-pronged approach, so we're dealing with those urgent priority works, working with the HSPs at those hospitals. But in addition, we'll be also undertaking a review and an audit led by, as we've heard from the Premier, Under Treasurer Michael Barnes and former Department of Health Director Neil Fong. This will be overseen by the Department of Premier and Cabinet, and the purpose is to look at our procurement processes, how we can be as efficient as possible to deliver the critical maintenance and upgrades that we need in our hospital system. In terms of the $50 million delivery of those new funds for maintenance, the Department of Housing and Works will help oversee that fund and the delivery to get money out the door, and we anticipate those works will begin this year. I do want to stress this, that we are already making a significant investment at Charlie's. It's an estimated $113 million. That does include a total redevelopment of the emergency department at $50 million, but also a new ICU unit, plus other refurbishment works. So there is substantial work being undertaken at Charlie's, but this is an acknowledgement. There's more work to do, and accordingly, with creating this new fund and getting the new Department of Housing and Works to undertake and accelerate that delivery. Happy to take any questions.
Will $50 million be enough?
So what I would say is it's the start. So we are already spending $271 million on maintenance this year. The $50 million will be an additional amount, but what I'm indicating is that the review and audit will then inform future decisions. So it's the start.
And also, would you have allocated this money and made today's announcement if you hadn't have suffered a week and a half's worth of beltings for things that are going wrong?
So look, I acknowledge we've listened and we're acting. I acknowledge the concerns and recognise the concerns raised by the community and the reports in the West Australian. I'm taking it seriously. We are acting. We are responding. But I'm also demonstrating that we've got a reform piece here. So I want us to do better at how we maintain our hospitals. And so that's two ways, by providing additional funds, but also looking at the procurement process. I went out to Charlie's yesterday. I met the management team. I went to some of the sites described. I've been to Charlie's before. It was great to actually talk to the maintenance leadership and some of the challenges that they face in an ageing hospital. And so I acknowledge the good work already being done, but given the issues that have been raised, I have to look at how we can do even better.
Given what you've just acknowledged and the fact that hospital workers have been telling us they have been raising these concerns many times before internally, why wasn't it taken seriously before it hit the front page?
Look, can I say this? I respect and understand those concerns. I suppose this is the opportunity to have a formal review and audit. I think also the creation of the health infrastructure portfolio. It is a massive beast. We have ageing infrastructure. To have a dedicated health infrastructure portfolio with a laser focus on this particular challenge is important. So I'd say this, the health infrastructure portfolio represents an incredible opportunity. We know there are issues, they've been reported on. This is a demonstration today that we're listening, but it's a two-pronged approach. It's not just additional funds, it's looking at how can we do it better.
But last week you said that all of these leaks, each of these work orders were being fixed as soon as possible. What's changed?
I would say this, that I address particular issues, but I did acknowledge overall that there is significant maintenance issues, and that's what we're announcing today. So I haven't shied away, and I say this respectfully, Jess, I haven't shied away from the fact that saying we have very old ageing infrastructure. It is tough, but I acknowledge those concerns and we're acting on it.
Is it possible to fix the sort of issues we're talking about at Charlie's in particular, at the pipe network and the like? Is it possible to do a complete fix without patient disruption and staff disruption?
Look, so the works that we're doing as part of this blitz can be considered from very minor, so it might be painting, other cosmetic changes, to then re-engineering of pipes, reconfiguration, roof replacement and so forth. So some of it is easier to do, other will be more complex, but we've got to do it. We have to look at how we manage that, but we are working with the HSPs to identify the particular works that need to be done.
How
Will
does
this fund help with
this
patients needing beds?
Sorry?
Will this fund help with patients needing beds?
Well, we have a separate program, and I'll leave it to the Minister for Health to talk about our general program to boost bed capacity.
and also this won't go to fixing ramping, will it? It won't go to this does not go to addressing record ramping.
Well, what I'd say is I'd leave that to the Minister for Health to address that,
So there's
but
more.
we recognise that we've got challenges in the health system. But this is a very targeted approach at our ageing infrastructure. We understand that it's needed, but again, it's a two-prong approach. And it's not just about additional funds, it's also looking at how can we do it better. That's why I'm involving the Housing and Works to do that delivery. But also, is there any other ways that we can streamline procurement so that we can get money out the door faster?
Is this acknowledgement that this is necessary, does that also mean that, in fact, the opposition was not scaremongering when they said urgent action was needed?
Well, what I'd say about the opposition is that they did make statements in the parliament that were false. So, for example, they said there was a cut to maintenance funding. The advice from Treasury is very clear. That was not the case. The WA Liberals lied, and so as we've heard from the Premier, there has been a 40% increase when you compare the average spends. They did not use like for like. And also, respectfully, I've acknowledged there are significant issues that we are working on, but to say, for example, all the advice to me was there was not a radioactive leak. And I actually visited the pipes yesterday, spoke to the maintenance team directly. So for the opposition did make false claims in the parliament.
When you visited, did you take a close look at the ceilings, the corridors? Did you see what looks like mould? Are there still concerns around?
No, I did not from my walkthrough. No, and I have to say this: they're a really hard-working maintenance leadership team there. They went through details. We talked about projects. So I admire their work. I'm just looking at the broader system. I mean, we've got a lot of older hospitals. It is a big body of work. We know that, as you've identified, Jess, that when you're trying to work through infrastructure changes and upgrades, you've got a 24/7 live hospital. So that is challenging. And so some of these works will be immediate. Others will require engineering advice and assistance, but we're committed to getting it done.
Last week the Premier said we had a world-class health system. Is this an admission that we don't?
No, look, there's nowhere else around the world where I'd want to access healthcare. I have incredible faith in our hospital system and the staff. So, no, what it is acknowledgement is just the harsh reality that we are doing a big, bold infrastructure program, 3.2 billion, but we do face ageing infrastructure. Sir Charlie's is more than 60 years old. Obviously, we're building a new women's and babies hospital. That's a recognition that we have ageing infrastructure.
Can we ask the Premier some questions? Sure. Or was there another announcement?
Did you want to ask the Health Minister any questions before we go to issues of the day? Or?
Well, I just want to ask about just that question about the ramping.
Yeah, sure.
How this
sorry.
announcement today?
Yeah.
Sure. How does this announcement today address the ramping?
Well, obviously today's announcement is a really important announcement in terms of delivering improvements in infrastructure maintenance. One of the things that I've on the record have said before is that our emergency departments are full because our hospitals are full. Now, the reasons for that are there's a significant number of older Western Australians who are in hospital where they don't need to be, but obviously making sure that we're undertaking critical maintenance work ensures that our hospitals do have as much capacity as possible to assist with making sure that we're moving people through our emergency departments and then, as necessary, through the rest of our hospitals. So this is not the total solution to ramping, but it definitely is a great assistance in terms of making sure that our hospitals are fit for purpose.
Are you planning, as I understand it, to meet, you go to Canberra to meet with the Prime Minister, and what's the point, given yesterday you said, well, they're doing everything that they're doing?
Well, look, we will be travelling next week to Canberra. I'm very much looking forward to travelling with the Premier and with the Minister for Aged Care and Seniors. It's an incredibly important visit, not just to make the case to our Prime Minister, but to explain to the Minister for Health as well about the significant pressures in our system, but the fact that the Commonwealth contribution, both in terms of the number of aged care beds and in terms of the number of home care packages, is underdone here in Western Australia. So we will be making that case forcibly when we travel next week.
What's the solution in the interim for ramping? Because as you've acknowledged, it's like this month it's getting worse, not better.
Yeah, so we're going still through a very tough winter in terms of capacity in our hospital system, and particularly as it's measured by ambulance ramping. It is important to acknowledge that our EDs are performing well, as the Premier said earlier, in respect of people who seek emergency treatment and are treated in under 4 hours. But the work that we need to do, we're still going through it. And just last week, there were a record number of 000 calls seeking ambulance assistance. So we know that demand is very high still in Western Australia at the moment. And I want to acknowledge the incredible work that our health care workers are doing to meet that demand. But we are also continuing to invest in a range of different initiatives to assist in alleviate that pressure point in emergency departments. So those are things like the work we're doing with the WA Virtual Emergency Department and ensuring that we can provide appropriate care to people without them needing to attend an emergency department. It's also things like our State Health Operations Centre, which is allowing us to ensure that people are directed to the most appropriate hospital for their needs, as well as the important work that we're doing around aged care. Part of that is advocacy with the federal government, but there's a number of initiatives that we've been pursuing as well. And we'll continue to look at all the things that we can do to help to address it. We know it's an issue. We're going through a very serious winter. Like other states right around Australia, we've seen very high levels of demand, but we are addressing it with a range of initiatives, and we'll continue to look at what more we need to do.
Are EDs performing well when 12% of patients are taking more than 12 hours to go through an ED?
So we know our emergency departments are under pressure. They're full because our hospitals are full.
You can't say it's, record amounts under 4 hours when it's record amounts over 12 hours. I mean, that's not performing well, is it?
So we're looking at all the things that we can do. So it's worth, I think, considering the response of our hospitals in the context of what's happening around Australia, where we know there are very high levels of demand in hospital systems right around the country. So we are working incredibly hard. Our health staff are working incredibly hard, but we know we've got more work to do, and we're not shying away from that. Today's announcement is an important part of making sure our hospitals are fit for purpose and addressing those maintenance issues, but we'll keep looking at all the other things that we need to do.
The AMA and senior doctors say that 12-hour plus figure and more than 1 in 10 patients taking more than 12 hours to get through ED means that lives are at risk. They say that the studies out of the UK have shown you're at greater risk of dying if you're taken more than 12 hours through the process in ED. Are lives at risk at the moment in the WA hospital system?
So, of course, I'm always, very unhappy to hear those stories of people having very long wait times. We rely on the decisions that are made by clinicians, by doctors and nurses who are there on the front line, making those decisions about how people receive treatment. Their advice to me is that people will receive treatment in order that it's most required to address the seriousness of the health issues. But we are concerned, which is why we're looking at all the things that we can do to bring those wait times down, to bring ambulance ramping figures down, and we'll keep doing that.
Their advice to you has also very clearly been that we urgently need more beds, hasn't it? I mean, that has been their advice.
So we've been continuing to add more beds onto the system, so over 900 beds since 2021. Now we know we need to do more, which is why, and we're particularly concerned about aged care capacity, and that's why We're looking at all the ways we can increase the aged care capacity in the system, and one of those initiatives will be to travel to Canberra next week. But it's not the only thing that we're doing, and we're particularly concerned about aged care because older West Australians who need care are often in hospitals, and it's not the best place for them. With appropriate support from the Commonwealth, for example, with aged care packages, they could be getting care at home, and that's a much better setting, or if necessary in an aged care facility. So it's just one of the things we're looking at, as well as the time to think beds, as well as the low interest loans that we've have announced as part of the election, so that we can stimulate more capacity in terms of aged care here. So we're looking at a range of things, and we'll continue to do that.
Will this fund do anything to specifically address that need for more beds?
So the fund that's been announced today is around maintenance in those key hospitals, so Charlie's, Royal Perth and the Armidale Health Service. It will have a role in ensuring that that maintenance is delivered, and that is maintaining the capacity we have in those older hospitals. So this is one part to make sure that our hospitals are receiving the maintenance that they need. It's not the only part that we're doing, and of course we've got a range of other initiatives that are helping to build capacity in the system.
What's the net gain of average active beds in the hospital system since 2017?
So I do want to be clear about the difference between infrastructure beds and then active beds, because the active beds just measure a point in time. There is a range of reasons why those beds might not be available at a particular on a particular occasion. People might have been discharged from hospital, so those beds may still be needed. The rooms might need to be cleaned. The beds
are meaningless too, aren't they? I mean, that doesn't take into account any that have been mothballed.
So just to be clear, the active beds might be unavailable at any particular time, and part of that reason might be rooms need cleaning, might be because there's maintenance that's required. It might also be because people are required to be isolated, and the room itself might have more than one bed in it, but we can't use the second bed because the current occupant might have a contagious illness, as we've seen this winter with RSV and flu and upsurges in COVID. So there is a range of reasons, and it is important to remember that the figures quoted by the health spokesperson in Parliament last week didn't include any of the contracted beds that are also part of how we have been increasing capacity for public patients in this state.
So to clear it up then, can you tell us what is the net gain in infrastructure beds since 2017?
So we have tabled in Parliament the
That's
numbers.
Since 2021, some were closed before then. What's the net gain since 2017?
Look, we can provide those figures. We've put on the record in estimates the numbers of infrastructure beds by health service that we've put on since 2021.
Do you have confidence in Dr. Shelley Bowen?
Yes, of course I've got confidence in Dr. Shirley Bowen. She's doing a really tough job managing our health system through one of the most difficult and busy winters that we've seen in some time. And she is doing a great job working with all of the staff in the health system to respond to the particular demands that we have on the system at the moment. Thanks.
Do you regret standing up in Parliament last week and waving your hands around and accusing the opposition leader of being a risk of other people's lives?
Well, I certainly accuse the opposition leader of misrepresenting the truth when it comes to our hospital system, for scaring Western Australians when it comes to seeking healthcare. There is no other place where Western Australians can feel even most safe than in one of our hospitals. And the fact that he took the opportunity to run down the work of all our doctors and nurses and health professionals and to tell Western Australians that our hospitals are unsafe is quite frankly reckless and irresponsible.
Is this announcement a line in the sand on maintenance and ageing infrastructure at least, and therefore is it an acknowledgement and apology to the public for the state of the system currently?
It's certainly an acknowledgement that our older hospital infrastructure needs more care. Even though we've increased funding for maintenance by 40% more than the previous government, we acknowledge that we need to do more to make sure that our ageing hospital infrastructure gets the maintenance and care that it needs. And that means today's announcement with regards to the $50 million hospital maintenance infrastructure fund, and also the work that the audit and review will do, which is about making sure that we have clear line of sight on what needs to be done, but also engaging our teams in housing and works to make sure we can get that work done, the dollars out the door and improvements made.
If more care is needed, does does that mean that there has not been enough care, or at least not enough care fast enough?
Well, I think we've certainly seen an increase in funding in relation to hospital maintenance, and that's from around about $174 million a year in the last 4 years of the Barnett government to now $246 million a year over the last 4 years to 24-25. So you have seen a significant uplift in relation to maintenance work, and that program was ongoing. But this is in part us saying that we understand the anxieties and the concerns of the community. We're listening to those, and because we've protected the state's finances, we're in a position to make these investments.
Were you disappointed that the AMA appealed to you last week to stop describing our health system as world class, and will this announcement restore us to health to world class in your view?
Well, I don't think that there's anything to apologise for in relation to calling our system a world-class healthcare system. As the Minister Carey just said, there's no other place in the world you would want to be than in our hospital system if you have a need for urgent medical attention. And the work that the doctors and nurses do is part of that, making sure that we continue to have record levels of elective surgery, to make sure that we continue to receive a higher proportion of patients within the 4-hour rule than any other hospital system in the country, the fastest ambulance response times in the country. So there's work that always needs to be done, but there's also work to be proud of and to thank the doctors and nurses for the work that they do.
So do you stand by that description of the hospital system being world class, or do you regret the lack of nuance in that phrase?
Well, look, I think we should take pride in the great work that doctors and nurses do in our hospital system. And because of that, I'll always stand behind them, by them, and call their work world class.
But is the hospital system world class?
Well, we know that with hospital infrastructure, we need to continue to make sure we have the investments. Today's announcement is on top of the 40% increase in hospital maintenance funding that you've seen under my government. The $3.2 billion investment in ongoing infrastructure work is a sign that we are ready and we are continuing to make the investments necessary to continue to make sure that Western Australians have access to great healthcare.
What did you make of the Prime Minister's comments yesterday? He seemed pretty dismissive of the idea that the federal government's not holding up its end of the bargain on aged care.
Well, nationally, that's, I'm sure the Prime Minister is right that they're making record investments in relation to the provision of aged care. The fact of the matter remains, though, that Western Australia does not receive its fair share of either home care packages or aged care beds, and that's one of the things we'll be talking to the Prime Minister and the Minister for Health about next week when I'm in Canberra.
Should you have been talking more loudly about that to him before now?
Oh, look, there's always issues that we need to talk about in relation to defending the rights and interests of Western Australians, and that's why we have a strong relationship with the Commonwealth Government, particularly in healthcare. For instance, the work we're doing with them on our urgent care clinics is a really important part of fixing primary health care after it was basically delivered almost a mortal blow by the previous coalition governments. The Albanese Labor government is building primary care once again. They're investing significantly. The NDIS, aged care is another area where we want Western Australians to benefit from their great investments.
On ranting, how there seems to be nothing new to combat record rates of ramping, acknowledging the things that are happening for older adult health centres and things like that. Those will all take time. In the interim, with 240 hours plus ramping per day, what do you say to those patients and families, and what's being done about it?
Well, we want people to understand that we are making significant investment in all our health services. And in relation to our EDs, as I said, the highest proportion of fast treatment at EDs in the country. We continue to work on the virtual ED program, which has diverted many patients away from the EDs. We continue to work with the Albanese government to boost primary health care so people don't need to go to hospital in the first instance. Our State Operations Control Centre is about making sure we're engaging all the digital mechanisms that we have to make sure that our hospitals work better. And of course, you've seen the significant announcements that we've made, both in terms of the expansion of the virtual ED, but of course the expansion of the ED at Royal Perth Hospital and the ED at Midland Hospital. the Western Australian community can have confidence that we are making the investments, we are putting the measures in place, and we continue to do everything we can to ensure that our hospital system works as best as it can.
Premier, are you concerned about sovereign citizens operating here in WA and running their own courts, sentencing people, premiers, etc., operating sort of outside the system?
Well, look, I think they represent a significant threat to both social cohesion in Western Australia and also the rule of law. People live in Western Australia. It's a peaceful place. It's a safe place, and we want it to stay that way. And that's why the police do everything they can to monitor those who think that they're above the law, that they have their own law to implement separate from the rest of the community. We are all Western Australians. We should work together under the same laws to ensure we keep Western Australia as a safe and happy place to live.
Exactly the same as what we're doing, we're just monitoring their activities?
Not at all. We intervene when we see laws broken. We make sure that we do everything we can to ensure that they don't represent a risk to the community. Thanks very much, everyone.